Hi, everyone. Welcome to my channel. In this video, I'm going to be discussing the most common side effects and how fluoxetine affects your mood. Fluoxetine is a commonly prescribed medication and is used to treat many mental health conditions. It's important to understand how this medication works and what the potential side effects are. So let's dive into the details and learn more about fluoxetine. Citalopram side effects? Common side effects of citalopram include nausea, dry mouth, trouble sleeping, decreased sex drive, increased sweating, headache, drowsiness, and blurred vision. Other side effects may include fatigue, dizziness, heartburn, indigestion, diarrhea, constipation, increased appetite, weakness, and yawning. In rare cases, people may experience more serious side effects such as changes in behavior, difficulty concentrating, thought disturbances, seizures, and a fast or irregular heartbeat. If you experience any of these symptoms, contact your doctor immediately. Is citalopram a strong antidepressant? Citalopram is an antidepressant medication that is considered to be a strong antidepressant. It is a selective serotonin reuptake inhibitor, SSRI, which means it works by increasing the levels of serotonin in the brain, helping to lift mood and reduce feelings of depression. Citalopram can be used to treat both mild and moderate to severe depression, as well as other conditions such as anxiety, panic attacks, obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD. In clinical trials, citalopram has been found to be effective in treating depression and has also been found to be well tolerated with few side effects. It may take several weeks or even months before you start to notice an improvement in your symptoms, so it's important to be patient and continue taking the medication as prescribed. It is important to follow the advice of your physician when taking citalopram and be sure to take all doses as prescribed. What citalopram does to the body? Citalopram is an antidepressant that belongs to a class of medications called selective serotonin reuptake inhibitors, SSRIs. It works by increasing the levels of serotonin, which is a chemical messenger in the brain that helps maintain mental balance. Citalopram can help to reduce the symptoms of depression, such as low mood, loss of interest in activities, feeling tired all the time, difficulty concentrating, and changes in appetite. It can also help to reduce anxiety, agitation, panic attacks, and insomnia related to depression. In addition, it can help improve energy levels and reduce fatigue. However, it may take several weeks before the full benefits of citalopram are experienced. It's important to take this medication exactly as prescribed and not to stop taking it without consulting your doctor first. What should you avoid when taking citalopram? When taking citalopram, it is important to avoid certain substances and activities. Alcohol should be avoided when taking citalopram as it can increase the risk of side effects including drowsiness, blurred vision, and impaired coordination. Certain other medications may also interact with citalopram, so it is important to talk to your doctor about any other medications you are taking before starting a course of citalopram. Citalopram may also cause dizziness or drowsiness, which can impair your ability to drive or operate machinery, so it is important to avoid activities that require alertness such as driving or operating heavy machinery until you know how citalopram affects you. It is also important to avoid becoming dehydrated while taking citalopram, as this can increase the risk of side effects. Finally, it is important to follow the dosage instructions provided by your doctor, as taking too much citalopram can cause serious side effects. How should citalopram make you feel? Citalopram is a type of antidepressant medication commonly used to treat depression and other mental health conditions. It is part of a class of drugs called selective serotonin reuptake inhibitors, SSRIs. It works by increasing the amount of serotonin, a naturally occurring chemical in the brain that helps regulate mood and emotion. When taken as prescribed, citalopram can help reduce symptoms like sadness, hopelessness, lack of interest in activities, fatigue, difficulty concentrating, changes in sleep patterns and appetite, and suicidal thoughts. It may also help with physical symptoms of depression, such as aches and pains. Citalopram can take several weeks to produce its full effects, so it's important to keep taking it even if you don't feel better right away. However, if your symptoms have not improved after 4 to 6 weeks, talk to your doctor about adjusting your dose or switching to a different medication. Overall, citalopram should make you feel more positive and hopeful, and help you enjoy activities that used to be difficult. It may also reduce anxious or negative thoughts, allow you to get better sleep, and help you feel more energized and productive. How long can you stay on citalopram? The length of time that you can stay on citalopram depends on a number of factors, including the severity of your symptoms and how well the medication is working for you. Generally, it is recommended that you stay on the medication for at least 6 to 8 weeks before making any changes to the dosage or discontinuing use. However, some people may need to remain on citalopram longer, while others may find that they can stop taking it sooner. It is important to talk to your doctor about your individual situation before deciding to make any changes. Is citalopram better for anxiety or depression? Citalopram is an antidepressant medication that belongs to a class of drugs called selective serotonin reuptake inhibitors, SSRIs. While citalopram is generally prescribed for the treatment of depression, it can also be used to treat anxiety. Studies have shown that citalopram is effective in reducing symptoms of both depression and anxiety. In one study, citalopram was found to reduce depression symptoms more quickly than placebo and was as effective as a tricyclic antidepressant. The same study also found that citalopram was significantly better than placebo in reducing anxiety symptoms. Citalopram works by increasing levels of serotonin, a neurotransmitter that helps regulate mood. The increased levels of serotonin may help improve symptoms of both depression and anxiety. While citalopram is generally considered safe and effective for treating depression and anxiety, it is important to discuss any potential side effects with your doctor before starting this medication. Common side effects associated with citalopram include nausea, insomnia, and dry mouth. Severe side effects, such as suicidal thoughts or behaviors, are rare but should be reported to your doctor immediately. In conclusion, citalopram is an effective medication for treating both depression and anxiety. However, it is important to discuss any potential risks and benefits with your doctor before starting any medication. Does citalopram make you feel weird at first? Yes, it is possible to experience some weird feelings initially when taking citalopram. Many people report feeling more anxious or jittery in the first few days of taking citalopram, as well as having difficulty sleeping and feeling nauseous. While these feelings can be alarming, they usually pass within a few days. If these side effects are severe or persistent, it is important to talk to your doctor. In some citalopram can take several weeks to start working, so it is important to be patient and to stick with the recommended dosage. Does citalopram increase weight gain? Citalopram is an antidepressant medication that is part of a class of medications called selective serotonin reuptake inhibitors, SSRIs. It is used to treat major depressive disorder, panic disorder, and other mental health conditions. Studies have shown that citalopram and other SSRIs may lead to weight gain in some people. Weight gain is a common side effect of citalopram, but it is not experienced by everyone. The amount of weight gain varies from person to person, and the mechanism behind it is poorly understood. In some cases, the weight gain may be due to increased appetite, fluid retention, or decreased physical activity. In general, weight gain caused by citalopram is usually mild and may not be noticed unless a person is closely monitoring their weight. Some people may also find that they are able to manage their weight gain with lifestyle changes, such as eating a healthy diet and exercising regularly. If a person experiences significant or persistent weight gain while taking citalopram, they should speak to their doctor. They may be able to adjust the dosage or switch to a different medication. Is it best to take citalopram at night? It is generally recommended that citalopram be taken at the same time each day, either in the morning or at night. The decision of when to take citalopram should be made in consultation with your doctor, who will consider factors such as your individual health needs and any other medications you are currently taking. Generally speaking, there is no clear, best time to take citalopram. However, if you experience sleep disruption or insomnia while taking citalopram, it may be beneficial to take it at night. Taking citalopram at night may also help reduce some of its more common side effects, such as fatigue and drowsiness. Additionally, citalopram can sometimes cause an increase in appetite and cravings for high-calorie, sugary foods. Taking citalopram at night may help to avoid this side effect by reducing the amount of time you are exposed to food temptations during the day. Ultimately, the best time to take citalopram should be discussed with your doctor so that they can help determine the best option for you and your individual health needs. Can I drink alcohol with citalopram? Alcohol while taking citalopram, as it could increase the risk of certain side effects. Alcohol can also worsen some of the symptoms that citalopram is used to treat, such as depression and anxiety. Additionally, there is evidence that alcohol can interact with citalopram, potentially increasing the risk of more severe side effects. Therefore, it is best to avoid drinking alcohol while taking citalopram. If you are having difficulty limiting your alcohol consumption, talk to your doctor about other treatment options that could help. What does 20 mg of citalopram do? 20 mg of citalopram is an antidepressant medication that belongs to the class of drugs known as selective serotonin reuptake inhibitors, SSRIs. By blocking the reuptake of serotonin, this drug helps increase the amount of serotonin in the brain. Serotonin is a neurotransmitter that plays a role in regulating mood and emotions. Higher levels of serotonin can help reduce symptoms of depression, such as feelings of sadness, irritability, fatigue, loss of interest in activities, and difficulty concentrating. Additionally, it can help reduce symptoms of anxiety, including restlessness, racing thoughts, and difficulty sleeping. Citalopram is used to treat major depressive disorder and is most effective when taken regularly for at least a few weeks. The dose of citalopram ranges from 10 to 60 mg per day, and the 20 mg dose is considered a medium dose. It is important to note that citalopram can take several weeks to become fully effective, and it is typically recommended to take it for at least 6 to 8 weeks. Additionally, it is important to discuss any side effects with your healthcare provider and to follow all directions when taking this medication.